Good afternoon, everybody. My name is Victoria Lancey, and I'm the Rural Education Manager with the Michigan Center for Rural Health, and I will be facilitating this program. We're just going to go ahead and get started to be mindful of everybody's time. And I would like to welcome everybody to today's geriatric grand rounds on the Area Agency on Aging, meeting the needs of older adults. This program is provided by the Michigan Center for Rural Health in cooperation with the MSU College of Human Medicine and the MSU College of Nursing. Before we begin, just a couple reminders. If you're logged into the webinar portion and have computer speakers, you can listen to the audio through them. If you're listening to the program via the audio number, handouts are located on our website for you to follow along. Handouts, our website is www.mcrh.msu.edu. Click on the education link across the top, scroll down, find today's date, and then there you will see the presentation, and then as well as the evaluation link for physicians and the attendance form for physicians. Continuing education is available for physicians, nurses, and social workers. There is a new process for nurses and social workers. So as there is no attendance form, your registration was your attendance form, and your evaluation will be emailed directly following the program. The evaluation must be completed or within 2 weeks by May 23rd. Note, physicians, there is a new process for you. In order to obtain your certificate, you must complete this through the new CME portal. There are steps on our website, or you can email me if you have any questions. If you would like to have a question, if you would like to ask a question during the program, please type it into the chat box so you don't forget it, and the presenter can address it during the Q&A. If you called in on the telephone line, I will be unmuting the telephone lines so you can ask a question during the Q&A as well. Our speaker today indicates no conflict of interest, and there is no there were no conflicts of interest. There is no commercial support for this program. And with that, I am pleased to introduce Tammy Lemer, who is the Tri-County Office on Aging, and she is the Community Relations and Grants Manager. With that, I'll hand it over to Tammy.
Hi, everybody. I'm really excited to be able to chat with everybody today. I do work for the Tri-County Office on Aging, which is one of 16 area agencies on aging across the state of Michigan. And I'm going to talk a little bit about what we do locally, but really it's as a sampling of what the area agencies on aging do across the state and across the country. So for example, I'm trying to get my screen to advance. Here we go. We have been in existence as the Tri-County Office on Aging. We're actually going on our 45th year. We and other area agencies on aging, and I'm going to start using the phrase AAAs. I know that you're all going to jump to roadside assistance when I say that, but that's our kind of internal lingo. So the AAAs were founded as part of what's called the Older Americans Act, and we'll talk a little bit more about that as well. So here's a slide that talks about that. So in 1965, it was recognized that the needs of older adults may be a little more unique than the rest of the population. Obviously, there are healthcare needs, there are transportation needs, there are nutrition needs. And so the area agencies on aging, AAAs, were formed to help monitor and administer programs and services. And our focus in particular is on what we call in-home services. We are available to older adults, their family members, their caregivers, and in some cases, many of us also work with younger adults or with disabilities. And our mission, the mission of the Tri-County Office on Aging specifically, is to promote and preserve the independence and dignity of older adults. And I can jump to that here, because we exist to basically answer questions, help improve lives, make connections to resources, and help individuals live independently in the home. So we do that by, again, making links, answering questions, providing resources, and I'll dive into a little bit more of that in detail. So the structure, again, because we were originally formed from the federal government, there is an administration on aging out of the Department of Health and Human Services. And then we have state units on aging. In Michigan, it's called the Aging and Adult Services Agency, or ASA, which is also within our state Health and Human Services. It used to be its own entity, and then back when Human Services and Community Health merged, they also took Aging and Adult Services under their wing, so that they're all under that same umbrella now. So then we, as the local, we're either nonprofit organizations, some of us are 501c3 organizations, or some of us are actually units of government. So for example, here in the Ingham, Eaton, and Clinton County areas, we're considered a consortium. We're the Aging Consortium, and founded through a charter relationship with our 3 counties. And so we, our board of directors have representatives from the units of government from the 3 counties, as well as the cities of East Lansing and Lansing. And then we also have advisory council members who are local community members and service provider agencies. And those individual residents, those older adult representatives, are actually appointed by those 5 units of government as well. And so then we all work, as the chart shows on your screen, the types of things that we do. So access to services might be information, sharing, answering questions, either coordinating or helping to make available transportation. Nutrition, one of the more famous aging and adult services programs is Meals on Wheels, or what's generically called home delivered meals. But we also do nutrition counseling and education. We have a registered dietitian here at our office, and several of our AAA colleagues do as well, where there's health and wellness programs such as Diabetes Path, which is a chronic disease self-management evidence-based program. We do medical nutrition therapy, and also that dietitian, because we here at Tri-County have the nutrition program in-house, meaning we actually manage and fund the Meals on Wheels program. That dietitian actually helps to create the menus and to provide oversight for making sure the federal dietary regulations are being followed for older adults. I talked a little bit, well, so we have home and community-based services. We'll talk a little bit more about what some examples of that are. Disease prevention, health promotion. We have fall prevention workshops. We have a chronic pain workshop now that's just launched within the past year. And of course, vulnerable adult protection. So elder abuse, awareness, response, and issues related to harm and neglect. Was there a question, or I just thought I heard some background?
No questions.
Okay. So as a little snapshot, again, this is for Tri-County Office on Aging, but it's pretty standard across our network. We call ourselves the Aging Network, primarily serving adults age 60 and older, although there are some programs that are 62, some programs are 65. So we basically encourage people to say, as you're approaching those late 50s, early 60s, you may want to check in with your local AAA, see what's available, find out what programs or services there are. Most of what we do is at no cost to the individuals, to the public. We will, of course, ask for donations on occasion. We do fundraisers. We are considered a charitable organization, even though we at TCOA are, again, that consortium of the units of government. We are still considered a charitable organization, so we do fundraise. And so again, this is a little snapshot of the types of programs and the number of people served. This is just a kind of a little snapshot of some of the things that we do. Again, Meals on Wheels being one of our biggest ones, information assistance, which is literally just people available to answer questions, let folks know what resources are available in the community. Project Choices in Michigan goes by another term, which is called the My Choice Waiver Program. And I'll talk a little bit about that now too. What we do We are an agent that helps individuals who are Medicaid eligible and who are basically either currently residing in a nursing facility or require a nursing facility level of care. We can help coordinate and through Medicaid dollars help fund in-home services to meet those needs. And what that does is it helps allow those older adults to remain in their homes and in their communities. For the most part, that's where most of us want to stay. None of us have the goal of landing in a nursing facility. Sometimes that's necessary in more of a rehabilitation, short-term type of situation. But where we exist and we use those Medicaid waiver dollars to help provide the in-home services at a fraction of the cost of what a nursing facility stay might be. And so that's not knocking nursing homes. We have a wonderful relationship with our local facilities here in the capital area. The reality is, again, most people, that's not their preferred choice of where they want to age. So the in-home services that we are able to provide can create that, that opportunity for them to stay at home and to stay and remain independent. So the types of in-home services that we talk a lot about, besides the home delivered meals, we can do, or you know, we don't personally provide these services, but we contract with and partner with local agencies to do everything from, it might be chore services. It might be someone to come in to help with laundry or to help with dishes. It might be something a little more specialized where it's personal hygiene care, helping people with their grooming, getting dressed in the morning and getting ready for bed in the evening. It might be something, again, more specialized like medication assistance or helping to coordinate transportation to doctor's appointments, because more and more older adults are no longer driving, or maybe they never did, but maybe navigating public transportation is a little more difficult. So we can help with what's called non-emergency medical transportation. And again, that can be helping people get to their doctor's appointments, helping them get to the grocery store or the drugstore to pick up their prescription medication, wide variety of things. And then, again, as I mentioned, a lot of those programs are funded under the Medicaid waiver program, but we do have partnerships in the community, and there are also programs available where there are private pay options. And again, we can help navigate what's out there, who's doing what kind of service, what is your need, and who out there might be able to help them. Now, everything we do is completely transparent and non-biased. We don't ever make recommendations and say, you should work with XYZ company or XYZ agency. We are all about options. We are all about choice. And so that's kind of what this slide talks about in terms of being person-centered is the language we use, where it's about what the needs and wishes of the individual are. So we provide choices, we provide options, but we never make decisions for individuals. That's a really important piece of how we do our work as an area agency on aging. So again, it's some more detailed things about what those care options might be. We also provide what's called options counseling. So as we're getting older, we individually and or with our family members, it's helpful to have conversations about, well, what are our plans? What are my needs? How long would I like to stay in this home? You know, if all things, you know, are possible. So we have a trained counselor who will actually walk those family members through those conversations, start to dig into some of those more difficult conversations. These aren't necessarily end-of-life conversations. They're really more life transition kinds of conversations and questions. Another big piece of what we do, so in addition to, again, the individual programs and services that we might be providing or coordinating, we have an important focus on caregivers because we recognize how important those individuals are in the lives of those older adults and adults with disabilities. So we talk a lot about self-care. There are workshops and classes for those individual caregivers. We tend to focus on what we call non-professional caregivers. So again, typically those family members, it might be friends, it might be neighbors. And do one of the big classes we offer is something called Creating Confident Caregivers. And that's an evidence-based workshop, 6 weeks in length, where it's designed for individuals who are providing care for a loved one with dementia or Alzheimer's. And we've actually are launching a newer, well, new to us workshop, but other AAAs have been offering it, something called Powerful Tools for Caregivers, which is something that's available more broadly. You don't have to be someone who's caring for an individual with Alzheimer's or dementia. It's someone, you may just be providing caregiving of a variety of, in a variety of ways. So that's a wonderful opportunity that we do, again, providing the support to those caregivers. Not on this list, but another caregiving support we offer is something called kinship care. So that's when an older adult, often a grandparent, finds themselves providing the guidance and supervision of a minor child, so often a grandchild. Maybe the parent is no longer in the picture for a variety of different reasons. So not a lot of us expect to be providing care for a toddler or even a teenager when we're in our 50s, 60s, 70s, or 80s. So there are specialized resources available, kinship care resources that can help alleviate some of those pressures. Everything from support groups all the way through funding that might support summer camps or after-school programming for the youth. So to again give that what's called respite, to give that break to that caregiver, so that they're really not tied to that individual and providing care 24/7. Because that break in being able to carry out your own interests and meet your own needs is so important. So housing assistance is another thing we do. We basically are more of an information assistance provider. Again, we are not housing people by profession, but we have information and we keep track of the local senior housing and lower income housing developments in our communities, knowing which ones are senior friendly. The one piece that we do, which has a direct tie-in to housing, is something called the Nursing Facility Transition Program. So again, it's related to the Medicaid waiver, the My Choice waiver program that I mentioned. It's for individuals who are currently residing in a nursing facility, but their needs could be met in an independent living setting. And so we have a specialist who actually literally helps with that transition. They help with identifying a potential housing location, actually can, in some cases, help coordinate financial support for that move. It might be first month's rent or the deposit, or again, a lot of those out-of-pocket expenses. You might need furniture, you might need dishes, what have you. Think about, for those of us back when we were younger adults, that first move we made into an apartment or into our first home. There are expenses related to that. So the Nursing Facility Transition Program can provide resources and supports for making that move back home. And if I didn't mention it, I do want to point out or reiterate that nursing facility stay can cost as much as $180 or more per day, whereas the in-home services that we're able to provide through the Project Choices program is usually closer to around $78, $80 a day. So it's a fiscally responsible program that's still meeting the needs of older adults, and in a way that's being person-centered and focused on their individual needs and desires. So another program we would like to highlight that is offered through the Area Agencies on Aging is called the Medicaid Medicare Assistance Program. That's Michigan's name for what is called nationally the State Health Insurance Program, or SHIP. And what this program does is it provides trained counselors, volunteers, who can meet individually or as a couple with older adults to help them navigate, in particular, the Medicare process. But many of the people we speak with are what's called dual eligible, so they are eligible for both Medicaid and Medicare. And with the changes in Medicare that have been occurring over the past several years, and the options for supplemental plans and Medicare Part A, B, C, D, it's really hard for folks who don't live and breathe this every day to understand, well, what exactly is this? And what is this plan offering versus that plan? And what are my out-of-pocket expenses going to be? And what are my prescription drug costs going to be? And is it worth it for me to buy a supplemental plan so that I have a little extra coverage? It's very confusing, and we have trained folks who can help them literally navigate that maze of options. And something that's exciting and really important about this program, the MAP program, Medicaid, Medicare Assistance Program, is that these individuals are well trained and well versed in the wide variety of programs, and they are unbiased. They are not being trained, they're not being paid for by health insurance programs or health plans. So they're not going to try to pivot an individual toward a particular plan. They're not trying to sell them anything. They're literally answering questions, providing guidance, and giving options so that those adults can be well-informed and as knowledgeable as possible about the choices they're making. And this is a program that statewide has saved hundreds of thousands of dollars in out-of-pocket expenses for older adults because they've been able to help find either a more affordable or a better, more appropriate plan for those older adults. Here in the Tri-County area, Clinton, Eaton, and Ingham County, we literally saved individuals over $800,000, if you can imagine that. So think of that in terms of money that's staying in the community, going back into the community, being reinvested in the community. So it's a great program that we're really, really proud of. Unfortunately, it's a program that has been proposed for elimination in the last couple of federal budgets. So we had a lot of public policy advocacy that helped save the program for the fiscal year 18, which of course the budgets just got passed in April. That was a bit of a hardship for area agencies on aging that depend on, in a lot of ways, on those older American Act dollars. But we were thrilled to have it reinstated, and then now with the fiscal year 19 budget proposals out there, it was again, at least from the president's priorities, proposed for elimination. So we still have a lot of work to do to educate our lawmakers as well as our community members about how important this program is. So I've mentioned a couple times about the network, the Aging Network. We are members of the Area Agencies on Aging Association of Michigan. That is the collaboration of the 16 AAAs across the state. Some of us have specific names, like Tri-County Office on Aging. That's something that's pretty easy to remember. We are all divided in what are called regions. So some of the area agencies on aging have really exciting names like Area 1B AAA or Region 11. So it's a little interesting when you're trying to find us or you're trying to locate the area agency on aging for your area or your region. Sometimes we have what I call real names, and sometimes we have kind of complicated, not very helpful names. But there is a website you can go to, which will show you this map that I have on the screen now. So these are the region numbers. They're not all of the names. We are, the Tri-County Office on Aging is Region 6, so you can see we're kind of a little triangle area in the middle of the Lower Peninsula. And you can see the various areas. The Upper Peninsula, Region 11, they cover the whole UP, so they have quite the vast geographic area. And then you can see some of us are larger geographically and some of us are smaller. You'll see 1A and 1C. 1A is literally Detroit Area Agency on Aging, and 1C covers more outer Wayne County. So as I mentioned, there is a website. I meant to pull it up. Oh, here we go. It's on this previous screen. mi-seniors.net. They are actually transitioning to, again, a more readily accessible and recognizable name, 4am.org, but I don't know that address has gone live yet. But 4AM, of course, standing for Area Agencies on Aging Association of Michigan. So again, we're the network. We work closely with each other, in collaboration with each other, monitoring the needs of older adults. Our association helps us with public policy advocacy, again, watching budgetary matters and issues that face older adults. And those might be health and wellness related. It might be Medicare, or Medicaid rather, especially at the state level, state and federal level. If people are trying to talk about work requirements for Medicaid, what is the impact on older adults, but also what is the impact on caregivers? Some of those older adults may have a family member providing care support for them. They're not getting paid, but they are providing a really important service to that family member or to that older adult. So again, those are samples of public policy issues that we watch and again monitor in terms of how they may impact the needs of older adults. So that's a kind of a quick overview of who we are, who Area Agencies on Aging are, and the types of programs and services we offer. The slide now shows a few other resources. I mentioned the SHIP program, or in Michigan, the Medicaid Medicare Assistance Program. Obviously, Americans with Disabilities Act has great impact on older adults, especially as mobility changes with our physical wellness. The Administration on Aging is, as I mentioned, the federal agency, and then the Aging and Adult Services Agency from DHHS is our state agency. You'll see on their website address, they have OSA still. They haven't changed their link, but that's a precursor to when they were called the Office for Services to the Aging. That's their old name. Some of their documents still say OSA as well, but they are officially and have been officially for a few years the Aging and Adult Services Agency. So I will pause here. Would love to answer questions. Again, this was a very brief overview, but unfortunately, we find a lot of people aren't familiar with AAAs. They don't know who we are or what we do. So really appreciate this opportunity to talk about, again, who we are, what we do, make ourselves available to you, let you know that we exist in your community to support the needs of older adults, adults with disabilities, and their family members. So I'm happy to pause for questions.
Okay, so I'm going to unmute the telephone lines. So if you are on the telephone line, just be careful that I am unmuting you. So just be mindful of that. So all the telephone lines are unmuted, so you can feel free to ask your questions, or you can type it in the chat box. I have a question here. It says, who is eligible for respite care or respite program?
Well, actually, so for respite programs, I am not an eligibility specialist, so I apologize. I don't have all of the eligibility memorized. But generally, it would be someone who is providing, quote unquote, full-time care and support for typically a family member. So respite care, so again, that concept of respite is a break from that caregiving. So I don't have the specific eligibility, but generally speaking, if you are providing in-home support for a loved one, so this would be someone who is not currently living in a facility, not someone who's living in a facility where there is professional care available, but someone who's living in a home or community-based setting. And if you are providing that care, then respite services would be something that you could tap into. In Michigan, you may hear the term adult foster care or adult day programs. Those are typically facilities, community-based agencies that are providing that respite care. So typically what that looks like is that loved one, that older adult or that adult with a disability will actually go to that facility. It's kind of like a day camp, right? Or, it's a program, there's a socialization aspect, but there's obviously a a safety and wellness component to it. So by bringing that individual, knowing that that loved one is going to get supervised care and programming, it will allow that caregiver to kind of go about their day. In some cases, we're full-time workers and caregivers, so having someone to bring mom or dad or Aunt Susie during the day so that I can go to work, or I can attend to my children's education needs, I can go to parent-teacher conferences. Those are some examples of how respite care works, and I would just recommend that you actually contact your individual AAA for information about what that eligibility is and who the potential respite care providers are in your community.
Tammy, do you have a list somewhere of like all of the AAAs like in the state of Michigan and their contact information?
Yes, if individuals go to the website, the my-seniors.net, you can see on this screen slide, it says home, then AAAs. You can click on that AAA tab, and it will bring up the list.
Okay.
And all the contact information, both addresses, the jurisdictions of what counties they cover, as well as phone numbers and websites.
Great. Are there any other questions or comments from either anybody on the phone or into the chat box?
I know I kind of jumped through things rather quickly. I'd be more than happy to give a little more detail on any of the individual programs or services. The big takeaway message that we try to share is, for those of you who have older adults in your lives, either personally or professionally, you hear so often people saying, wow, I didn't know you were here, or I didn't know you did that, or I didn't know that support was available in my community. So you know, it's sort of a hard balance, because we're direct service providers, or we're facilitating direct supports to individuals. So we don't want to spend money on marketing or advertising or promotion. Unfortunately, we need to do a little self-promotion so that people know we exist. So we do certainly rely on word of mouth support to help people connect with us. And then again, we may not be the provider of the service as the AAA. We are very likely the conduit to connecting you with that community-based service.
I have a question. It says, is the AOA now called Admin for Community Living?
Well,
oh, it's the Association for Community Living. I think they're two distinct agencies still, although one is under the umbrella of the other, I believe. But if I'm mistaken about that, I apologize. But yes, the Administration on Community Living is definitely a federal agency that AAAs coordinate with.
Are there any other questions on the phone or using the chat box? Questions or comments?
I know some of you are coming from very rural areas, so again, the needs and the types of services that are available vary widely. So that's another reason to know who your AAA is and to be able to connect with them, because they really have their finger on the pulse, as they say, in terms of what's available and how to best meet the needs of older adults in those communities. A lot of the questions that we hear about are transportation related, housing related. We actually, as part of the Medicaid waiver program, and also through some of our aging and adult services money, what we call care managers. So they're nurses and social workers who work in pairs to do assessments, to help determine eligibility for programs and services. And then they also basically do the check-ins. So in other words, we've determined that someone needs home delivered meals or would benefit from home delivered meals, would benefit from in-home services maybe a couple days a week. And then our care managers will circle back with those individuals and check in, say, so how's it going? How, you know, have the people been coming when they're supposed to be coming? And, you know, is it meeting your needs? So that both from a customer service, but also a health and wellness perspective, those check-ins allow us to make sure that that individual is still getting what they need to live independently with health and safety in mind.
And then I have a few more questions. It says, can you elaborate on the Michigan Choice Waiver, especially particularly the amount of time available for the MI Choice Waiver, elaborating on cost and eligibility?
I can give broad information. So it's the big, I guess, talking points related to the My Choice or Project Choices waiver is individuals do need to be Medicaid eligible. Now, if they're not yet receiving Medicaid support, we do have eligibility specialists who can help them with those applications and help them basically obtain that Medicare eligibility. And they have to be individuals who are, again, there's what's called a level of care threshold. So I don't have all of the specifics, like the check boxes that they need to go through, but it's basically someone who whose needs could be met in a nursing facility, or may in fact already be in a nursing facility receiving care, but who, if they could receive that care at home, we will coordinate that care, and it would be Medicaid funded. So nursing facility care is a Medicaid eligible expense. So what the Project Choices program does is it takes those Medicaid dollars and it reallocates them to the in-home care. So what I would recommend, if you want details, so there is no age eligibility for that program, I should clarify. That's why I talk about serving adults with disabilities as well. So it could be a younger adult with a disability, or what we would call typically an older adult, someone who's age 60 or older. But you would want to connect with someone, you know, and our folks would be happy to talk with you, but connecting with your local area agency on aging would be the first start, because they could walk you through exactly what does that look like, what does it mean to be nursing facility care eligible.
And then I have
know that's not particularly helpful, but I don't want to give a lot of details and not be fully accurate about that.
And then we have a few more questions. It says, can you tell us what the difference between care management services and the Medicaid waiver program?
Yes, so the Medicaid waiver program, all of the services are paid for by Medicaid. So we have our care managers who are helping to coordinate those services. Sometimes our care managers are literally helping to make the arrangements, sometimes doing the scheduling. But that is something that's all paid for, and it fits under that Medicaid eligibility. Care coordination or case management is a similar program, again, where we have the care managers who can be providing oversight, check-in. They may help to coordinate some of those programs and services, but those programs and services may be private pay. In other words, Medicaid is not paying for that service. It's something that you as the client, or you as the family member of the client are paying for out of pocket. So it's helping to make those connections and to coordinate the services, but the services aren't necessarily paid for by the Medicaid dollars. There are some Older Americans Act dollars for in-home services that can cover some of those care coordination, case coordination expenses. But again, that starts to get into an eligibility issue, where we'd recommend that you call and talk with an eligibility specialist, where they will walk through what your circumstances are, what the needs are, and what is the most appropriate program or level of service for you.
And then another question is My Choice eligibility affected Medicaid step downs?
I cannot answer that question. I'm sorry. I would recommend that you contact one of our Medicaid eligibility specialists.
Okay. So they would need to that person needs to contact one of your eligibility specialists, which can be found on your website, on the myseniors.net website.
Correct. That will be the list for the area agencies on aging for your area. And so you just contact that AAA and let them know the specific questions that you have, and they will identify the appropriate staff member to answer those questions for you.
Great. Are there any other questions or comments? I will unmute the telephone lines and then you can ask questions as well. Any other questions or comments?
One, since we seem to have a couple of minutes, one program that I didn't mention, which is actually a wonderful program that falls under the category of nutrition supports, are what are called congregate dining sites or senior dining sites. So, for our model, where we have the centralized kitchen right here in our building, so we're cooking the meals for the home delivered meals. We're also cooking meals for more, it might be more family style served, or it might be the individually packaged meals, but those meals are delivered to a local community-based setting. It might be a senior center, it might be a community center, it might be a local place of worship, pretty much anyone or anywhere that has a kitchen available to us, not for serving purposes, but just sort of for the cleanup and I should say not for the food preparation perspective, but more from the service perspective. And those meals, again, are cooked here. They're still following those same dietary guidelines for older adults. And it creates a socialization opportunity for those older adults. So again, these are individuals who are likely a little more mobile. They may be healthier physically, but they're able to come and gather. So they're getting the benefits of the nutrition as well as the socialization. So many of the facilities, many of our dining sites will have bingo or cards, or they'll have guest speakers and programming. Some of them actually even coordinate field trips, in a wide variety of different activities for those older adults in their communities. So that's another program. Not all area agencies on aging have a nutrition program in-house, but many of them will actually help fund, basically funnel the money through to that local service provider. So the home delivered meals, AKA Meals on Wheels, as well as the senior dining sites are both very important components to the nutrition program. And I'll tap onto that as well. For those of us who do have the Meals on Wheels program and are offering other types of programs, the health and wellness classes, et cetera, we are often looking for volunteers. It is a huge need. Something I didn't even mention at the onset that I usually talk about is the reality of the changing demographics. We are an aging society. Our longevity is getting longer. We are living longer, and ideally, we want that to be with a positive quality of life. So we exist to help support that aging in a positive, safe and positive way. So volunteers help us extend the work, help us to make greater connections with those older adults in our communities. So I'll give a little plug for volunteering, whether it be for Meals on Wheels or for the dining sites or helping to facilitate our evidence-based programs. Again, and our advocacy. I mentioned the public policy advocacy work that we do. We're not, as nonprofits, we're not able to lobby per se, meaning we're not able to speak in favor or against specific bills or legislation, but we certainly can educate our lawmakers, say, this is the impact on our older adults. This is the impact on our communities as it relates to either legislation or budget priorities, et cetera.
Can you remind us what that nutrition program that you were just talking about, the dining program?
Yes. Yep, they're either formally called congregate dining sites, so people are congregating together, or more regularly, they're just called senior dining sites. And of course, with the home delivered meals as well, we often try to talk about, again, it's not just the meal, but there's a socialization aspect that's happening as well. So we know that there's going to be a person knocking on that door Monday through Friday, and in some cases, some areas they deliver 7 days a week. Here in our area, it's Monday through Friday. So there's going to be a knock on the door. It can serve as an informal check-in, if you will.
Right.
And we have protocols in place that, you know, hey, no one answered the door today, or I noticed something. I'm a little bit worried about this. We've had stories where the older adult had fallen. You know, as cliche as that sounds, our volunteer was able to call for assistance and to help that individual. So there's a wellness aspect, there's a socialization aspect, and obviously there's a nutritional aspect to that program.
One of the questions that we just received was, is the AAA operated on federal funds, or is it operated on grants? And do they allow donations?
We absolutely accept donations. If you look at our pie chart of funding, a significant amount of it is federal dollars, or dollars that go to the state first and come back out to us as the AAA. Again, under that Older Americans Act legislation back from the 1960s, we are authorized to be the providers of services. So again, a lot of our funding is federal and state. We, in our area, also get local county funding, as well as in some cases city and township funding, because they recognize that we are providing a huge service to their residents and focused on health and wellness of their older adults. And in our case, we actually do a couple of fundraisers. Just as a matter of fact, we have a 5K run that's coming up in Lansing on June 19th. So we have a golf outing. It's actually our 30th annual golf outing, if you can imagine that, coming up on June 12th. And then we do a what we call our dinner and auction, so kind of a traditional gala celebration that we hold in the fall. So not all AAAs do a lot of active events or fundraising as we do, but there's a greater recognition that more community level support, private donations, corporate support is more and more critical, again, because of that aging demographic. In our area, in the greater Lansing area, some of our communities are approaching 25% of their population are age 60 and older. And that number is going to continue to rise as the baby boomers all turn 60, 65. So the federal money, the state money has not been keeping up with the needs, quite honestly. So that is why more of us turn to fundraisers. You know, we do an annual appeal letter like most nonprofits do. And again, while we don't charge for services, more and more often we try to talk about how welcome donations are to support the program. For our Meals on Wheels clients, for example, no payment is expected. We're not allowed to collect payments, but we do actually communicate to the individuals the cost of the meals and how many meals they received. So if they were so inclined, again, there's no economic requirement for the Meals on Wheels program. So if they're inclined and wanted to make a donation in recognition of that service they're receiving, they are certainly welcome to do so. So that was a long answer to what could have been a short, it might have been a short answer, but I wanted to give you all that background.
No, that was great information. Thank you. Do we have any other questions or comments?
Well, as we wrap up, I do just want to thank everybody for being on the call. Thank you for your interest in services for older adults. And again, I can't stress enough, I'm just one representative of 16 of us across the state. And if you haven't connected with us, with your local entity, I absolutely encourage you to do that. More and more of us are looking to engage in partnerships with healthcare providers, especially as it relates to our evidence-based programs. I briefly mentioned we have our Matter of Balance fall prevention workshop, the chronic pain path with the opioid epidemic, booming the way it is. A lot of providers are looking for pain management alternatives. So our chronic pain path is one option for adults to give them some helpful tools and tips for their pain management. And I mentioned the diabetes path. PATH actually stands for Personal Action Towards Health. So the diabetes path is that, I apologize, I can't remember if it's an 8-week or a 6-week session, but a weekly session, again, focused for individuals who have a diagnosis of diabetes. So it is not a diabetes prevention program. It is for those who are already trying to manage that diagnosis, but it helps them with some very important resources. Might be things like portion control, reading a nutrition label, but there's also an element of peer support that, we're kind of in this together. We may need to change some behaviors, change what our eating habits look like. And it's someone who's coming at them, again, not usually a medical professional, but it could be a medical professional training or facilitating that workshop. But we definitely rely on referrals, or I shouldn't say we rely on, we very much welcome referrals from healthcare providers. And some of us, again, we're trying to build those partnerships where in our area, some of our health plans and some of our local physician groups are actually sponsoring workshops for us, meaning they will help cover the cost of those workshops. And it's not a lot, but there are program materials, and we want to thank our facilitators with a very small stipend and mileage expenses. Healthy snacks. Again, if you want to model that healthy behavior, they bring in healthy snacks for the workshop. So it's not a free program to run, and again, we welcome those community partnerships to help us expand the reach. And my contact information is here. Again, I'm happy to be a contact for any of you, regardless of where you are across the state, or if for some reason you're having trouble connecting with your AAA, although if you go to the website, the information is there. You shouldn't have any trouble. But if you're curious about specific programs or terminology, or you kind of want to know or clarify, how do I pose this question, or what am I asking? I'm happy to help with that. It's interesting because we're sometimes compared to a 211 type of service, especially our basic information and assistance. But what we find, and this has been documented, a typical 211 call where someone's calling and saying, hey, I'm looking for XYZ. A typical 211 call may only last a couple of minutes, and usually not more than 5 minutes. And our information assistance calls often last 15, 20 minutes or more, because we take the time to listen to the individual and really try to understand the question that they're asking and what are they really looking for. Because they may say a buzzword. They may say something like, I need help with housing, or I need help with my home. Well, that help with housing might be foreclosure prevention, or it might be home repair, such as installing a ramp for mobility issues, or modifying a bathroom, putting in grab bars for safety in that bathtub or in that shower. So again, we try to dig and determine what is it that you're asking, and what are your needs here, rather than saying, oh, I heard a buzzword, I'm going to give you a phone number, and it may or may not be the most appropriate number. It may not be someone who's even in a position to help them. Not to knock 211, because they're a great service and they're very, very important in the community. But if you're looking for more specialized information, that's the role your AAA can serve.
That is great information. Thank you, Tammy. If we don't have any other questions or comments from our audience, we'll go ahead and sign off for the day. And I have recorded our webinar for this evening, this afternoon. So I will be posting it up on our website for everybody's future reference. Thank you everybody for joining us and have a great day.
Thank you, everybody.